Breast care and breast cancer prevention. Why waiting for symptoms is already too late. Introduction. Why breast care is no longer optional. Most women believe that breast health begins when a lump appears, but by the time a lump can be felt, disease has often been developing for 5 to 10 years. Breast cancer is not a sudden event. It is a slow breakdown of tissue regulation, immune surveillance, hormonal balance, circulation, and cellular energy. Modern life creates a perfect storm. Chronic dehydration, hormone disruption, lymph stagnation, toxic accumulation, chronic stress, low cellular energy. Yet women are taught only to screen and wait. This is like checking smoke alarms instead of preventing fire. Breast care must begin long before disease. Why the breast is uniquely vulnerable. Breast tissue is not just fat. It is one of the most hormonally sensitive tissues in the body. It is also highly vascular, highly lymphatic, highly electrically active, rich in estrogen receptors, designed for rapid cellular change. This means any disturbance in hormones, hydration, blood flow, lymph flow, or cellular energy affects the breast first. That is why breast pain, cysts, fibroadenomas, and cancer are so common. The hidden driver: lymphatic and fluid stagnation. The breast has no pump. It relies entirely on movement, hydration, electrical signals, muscle contraction. When lymph flow slows, waste accumulates, estrogen becomes trapped, inflammation rises, immune cells cannot reach tissue, abnormal cells survive. This is why tight bras, inactivity, dehydration, stress, and poor posture quietly increase breast disease risk. Hydration, the forgotten anti-cancer strategy. Breast tissue is 70 to 80% structured water. Water in the body is not just fluid. It is a transport system, an electrical conductor, a detox pathway, a cellular communication network. When women are chronically underhydrated, blood thickens, lymph slows, oxygen delivery falls, cellular waste accumulates, DNA repair weakens. Cancer thrives in dry, acidic, stagnant tissue. Hydrated tissue resists cancer. Why mammograms are not prevention. Mammography finds tumors. It does not prevent them. Prevention happens when tissue oxygenation is high, immune surveillance is strong, lymph flow is active, hormones are balanced, cellular voltage is high. You cannot X-ray your way to health. The role of energy medicine in breast health. The breast is not just biological, it is bioelectrical. Every cell depends on voltage, electron flow, mitochondrial energy, redox balance. When cellular energy drops, DNA repair fails. Abnormal cells escape. Inflammation rises. Tumors grow. Energy-based therapies, PEMF, light therapy, vagal stimulation, terahertz, etc., improve. Blood flow, oxygen delivery, lymph drainage, mitochondrial function, immune activation. Cancer cells cannot survive in high-energy, oxygen-rich, electrically stable tissue. The breast is an emotional organ. Breasts are deeply connected to identity, nurturing, femininity, emotional safety. Chronic emotional stress alters hormones, immune function, autonomic nervous system, tissue repair. Unprocessed fear, grief, and self-suppression quietly create disease-friendly biology. Healing must be emotional as well as physical. The 6 pillars of breast protection. True prevention is not a pill. It is a biological environment. 1. Deep hydration with electrolytes. 2. Daily movement and lymph stimulation. 3. Hormone-supportive diet. 4. Regular breast self-touch and awareness. 5. Stress and nervous system regulation. 6. Cellular energy restoration. Together, these change the internal terrain so cancer cannot grow. Why early care is more powerful than early detection. Detection finds disease. Care prevents disease. By the time cancer appears, the body has been failing quietly for years. The breast is a messenger. When it becomes sick, it is telling us the body's internal environment is no longer safe. Closing. The new vision of women's health. Breast cancer is not a mystery. It is the predictable result of chronic dehydration, lymph stagnation, hormonal chaos, low cellular energy, high emotional stress. A woman who protects her water, energy, movement, emotions, nervous system is not just preventing breast cancer, she is protecting her life force. The future of women's health is not fear. It is understanding, awareness, and biological empowerment. And breast care is where that future begins. Thank you, Holistic Wellness Foundation. Imphal, healing beyond boundaries.